start by washing my hands in the sink. Trash. Grab some gloves. And we're gonna do Trach Care. I'm gonna come over here. I have my supplies on the bedside table. Gloves on. Okay. And then we start by introducing ourselves. Hello, Miss Jackson. My name is Andrew, and I will be your nurse today. I need to identify you with 2 identifiers. So, can you please tell me your name and your date of birth?
Latoya Jackson.
And
February
okay.
18th, 1943.
Okay, thank you. It's good. Okay, now that I've identified her, I'm going to prepare to suction her. So I first start by testing the suction machine. So I turn it on, and I make sure that the reading is below, it's below negative 150 units of mercury, and then I also see if I can feel the suction, which I can, so I know that it's suctioning. And so I leave that there, and I'll take a pulse oximeter. Well, at this case, there's not one, but so I would attach that to her finger, and so I can monitor throughout the procedure her pulse ox status to know if she's needing more oxygen. And to prepare for the procedure, what I'll do is I'll turn up her oxygen to begin with to hyperoxygenate her. And then that way, whenever we're doing the procedure, like the suctioning, we're aiming above so that it's gonna deoxygenate her doing this procedure. So this way she'll still have a good blood oxygen level. So at this point, what I'm gonna do is I'm gonna prepare for the procedure. And so I'll start by opening the catheter kit and opening this is for later, so this is opening my Trach Care kit, and so I'll take those, put them over here for now, and then I'm going to go ahead and I'm going to, is there, can you grab me that hand sanitizer? I'm going to go ahead and take off these gloves, and I'm going to put on sterile gloves so I can just set up my sterile field that way. So I'm going to put this down. And then do hand hygiene. Make sure they dry so I can put my sterile gloves on. And while I'm doing this, I'll explain the procedure. So, Ms. Jackson, I'm going to do Trach Care and suctioning on you today. And what that is your gauze, it's been getting dirty from all the secretions from your stoma, from the trach. And so I'm going to change the dressing, and I'm going to do suctioning to help clear some of the mucus that's in your airway right now. Do you have any questions?
No.
Okay, that's good. So now I'll proceed by putting on my sterile gloves. Okay, so now I have my sterile gloves on, and I will remove that, and now I can touch anything within my sterile place since I am sterile. So I'll go shiny side down, and I will set up sterile gloves. And this is our sterile water, and I have my catheter in here, which I'll just go ahead and remove. And then I'll also go ahead and take out these sterile gloves for later, and all of the gauze, including that, and the tie. And then, since later we're gonna have to use the saline, I'll go ahead and pour that in each of the sections for the care. And then with that, I will now proceed with suctioning the patient. And so I'll take my catheter, and this will be since it's my dominant hand, my sterile hand, and I grab the suctioning tube and I connect it, and I can hear the suction going, but to ensure, I will suction up a little bit of water. And so it's working, and I will quickly insert it until I feel resistance. I'm gonna pull up 2 centimeters and then apply intermittent suction. Okay, and it seems like her oxygen sats are going well, so I'll just leave it at that with the suctioning. But before, I'll quickly clear the line of any mucus, and I will detach the suction, and I turn off the suction machine, and I have the catheter still, so I take it in my glove and I remove it. I remove my gloves and set them aside, and then at this point I'll assess hand hygiene, and I'll assess Mrs. Jackson. How are you feeling with the suctioning? Oh, you're feeling better? Okay, great. And I will at this point I'll return the oxygen levels to the prescribed level, and then we'll prepare for the actual trach care.
First and foremost, hand hygiene. Alright, and then now we don our clean gloves. Alright, at this point we take out non-disposable inner cannula. And we put the inner cannula in this sterile saline solution. Alright. And take off the gloves, dispose of it. And at this point, hand hygiene. And I'll make sure to see if the patient needs to be hyperoxygenated if their O2 saturation is low. Hygiene. And now we'll don on our sterile gloves. At this point, with my left hand, I'll be cleaning the cannula on the inside And the outside, making sure to loosen up any secretions that's stuck on the tube. Clean. Alright, and we'll dispose off of the brush. And with my sterile hand, I'll grab this sterile bottle of saline and make sure to rinse off the non-disposable inner cannula. And then we proceed to reinsert it back into the tracheostomy. And after this one, we proceed on to cleaning the tracheostomy site. First, we'll take off the drain sponge, dispose of it, and with a sterile hand, get the Q-tip, dip it into the clean, sterile solution, clean the outside. Dispose of the Q-tip. And we'll proceed to clean the stoma, cleaning in a circular motion and outwardly. We dispose of the Q-tip. And at this point, we're going to be drying off the site. So, with a dry gauze, we'll dry off the outside first. Right. Dispose of the gauze. Grab another clean one. Pat dry around the stoma and any of the areas we clean. And dispose of the gauze. And at this point, we put in a new drainage sponge. Okay. Once the drainage sponge is replaced, we're gonna replace the line that keeps the tracheostomy site in there. Alright, so we're gonna ask Ms. Jackson to lift her head up. Making sure to feed the line through the tracheostomy. There you go. Alright, and then we take off the old line. To make sure it is fit on there correctly, we're going to see if we can fit 2 finger breadths around the tie. There you go. And Ms. Jackson, does that fit comfortably around your neck? Alright. At this point, we're all set. And now the only thing left to do is to dispose, clean up, and replace the cap on the saline solution. Make sure we label and date when we open it. Let's see, and the date. 7/19. And we clean up our area. All right.